come to work with me as a labor and delivery nurse. So today was Saturday of the Easter long weekend. I worked a little princess shift from 7:30 a.m. to 3:30 p.m. I took the last 4 hours off so that I could join my family for a nice Easter dinner. I actually had a really great shift. This was, dare I say it, a quiet day. So we were able to do a lot of stocking. I set rooms for deliveries and just made sure the unit was ready to go for anyone who walked through the door. We had one patient in labor who I was not assigned to, so I just spent the morning stocking, making sure everything was good to go in case we had more patients. It was a holiday weekend, so I sometimes feel like it can be a little bit quieter on these weekends, but I made sure everything was ready to go. I even dropped a couple supplies. That always happens. I am such a klutz sometimes, so I made sure to throw out that cord clamp and get a new one before I set this delivery table. But I made sure the room was ready to go and all the safety equipment was in place. This is a big part of our jobs as labor and delivery nurses, is making sure everything is there in case of an emergency situation. So I made sure that the baby warmer was ready to go with all of the respiratory equipment in place. I also went to the stock room multiple times, and it always takes me forever to actually locate what I'm looking for, even though I've been in this stock room thousands of times. Can anyone else relate to that? So I made sure to test the ambu bag here. So this is what we use to breathe for baby if baby comes out and is not breathing. So I tested it, made sure it was all ready to go in case someone did deliver in this room. Pillows are always missing in the hospital. What is it? Why can I never find pillows? I was actually able to locate one, but I spent the rest of the morning, doing a little bit of my schedule. I had some breakfast, and then while I was on my lunch break, I actually did my hair because I knew I was going straight from work to change and go to Toronto for a dinner. So I made sure to do that, and then I had a triage patient. And then before I knew it, it was 3:30 and it was ready for me to go home. I made sure to change quickly into my Easter outfit, and then we headed off for a little dinner.